There are concerns of a global cancer burden that is growing and enough is not being done to intervene with services. According to the World Health Organization, most countries are not adequately financing priority cancer as well as palliative cancer services. Joining us is Dr. Catherine Kaschula, who's from the Department of Chemistry and Polymer Science at Stellenbosch University. Dr. Catherine, a pleasure to have you on the program this afternoon. Firstly, can you provide an overview of the latest estimates from the International Agency for Research on Cancer regarding the global burden of cancer?
Look, I'm not actually, I don't sort of have all of those stats.
Sure.
So my speciality is more kind of like managing, I suppose, the cancer numbers. So it's looking at cancer prevention strategies through dietary intervention. So, that's what a lot of my research has been looking at. So specifically looking at a lot of the cancer-fighting chemicals which are present in the diet and in food, and how it's possible to actually sort of decrease your risk of cancer in sort of a cancer preventative manner by actually dietary intervention.
That's duly noted. So to take from the agency, I mean, they estimate highlight growing cancer disparities and also the urgent need to address cancer inequality. What are your thoughts on some of the findings in this regard, and how can these disparities be addressed on a global scale?
Yes, so, I mean, look, there's definitely disparities when you consider a country like South Africa and you compare it to sort of like globally. And there are actually sort of different numbers in the cancer prevalence, the incidence and mortality in sort of, let's say, South Africa or other third world countries compared to first world countries. And a lot of this also comes down to kind of like the very early stages. So in other words, access to early screening and cancer preventative measures. So, for example, I mean, breast cancer is the most prevalent cancer in females, both globally and also in South Africa. But you'll actually find that the incidence in South Africa is higher than the global incidence. And also for other cancers, for example, like prostate and cervical cancer. Yeah. And, these three cancers are largely preventable through, early detection and screening, especially cervical cancer. A large number of those cancers are preventable due to the availability of this vaccine. Also, prostate cancer, there are a lot of screening methods that are available as well. So, a lot of these, the cancer incidences, which are higher in this country compared to the global average, a lot of those numbers are actually down globally because of the kind of early intervention strategies. So, I suppose we always hear that about early intervention, because if prevention is better than cure, and, you have a much higher chance of actually beating cancer if you kind of get it early. So either you don't allow it to develop at all, or you detect it very early so that you're able to kind of treat it early. And then, which is a much better strategy than kind of like not detecting it early, not being able to prevent it, and then perhaps only detecting it much later. Because obviously more late-stage cancers are much more difficult to treat. They're also much more expensive to treat. There's limited treatment options and also like a lower chance of success. So I'm not sure if that answers your question.
It does, and it also leads me to this as well. I mean, the WHO, or the World Health Organization survey, is also revealing that many countries do not adequately finance priority cancer as well as palliative care services. How do financial challenges then impact the delivery of cancer services? And what steps do you believe can be taken to improve funding for these essential services?
I suppose you'd have to speak to the health minister about that. But, I mean, again, a large portion of the population don't have access to private healthcare facilities, so they are dependent on the government facilities. And so these definitely need to be funded so that there is better access. And again, it's that key sort of early prevention and early detection, which is important. Yeah.
Earlier on,
I mean, more people in private healthcare would probably have access to those facilities. Although the cervical cancer vaccine is available to everyone. All young girls, I think from the age of 8 in schools are receiving that vaccine, and that is through the government.
Dr. Catherine, earlier on you mentioned estimates of the 3 major cancer types in 2022. That's lung, breast, and colorectal cancers. What are these cancer types, or how are they impacting the global health? And what challenges do they pose in terms of prevention, diagnosis, you also mentioned, as well as treatment for cancer?
Yes. So, as I mentioned, a lot of these cancers are potentially preventable, through early detection and screening methods. But also, I'd just like to highlight, as I mentioned, prevention's better than cure. And there are a lot of steps that we can take to actually prevent these cancers. And I think, as you mentioned, sort of financially, and especially in a country like South Africa, where not everyone has got access to private health care, there are a lot of preventative methods that we can actually put in place to actually stop these cancers in the first place. And because cancers take a while to actually develop. So a cancer doesn't come around overnight. It often takes many, many years. Like, for example, breast cancer, from the time that you have a small little mutated cell to when it actually becomes a 1 centimeter tumor, takes like 12 years. And if you can actually detect that cancer or actually prevent it during that 12-year period, you've got a much better chance of actually being cured and not actually developing full-blown cancer. And there's a number of steps which, are sort of available to everyone. And as I mentioned, the sort of dietary intervention that I've been doing a lot of research on. And there's actually a lot of cancer-fighting chemicals which are present in a lot of dietary foods. And so, if you limit your exposure to a lot of environmental carcinogens, for example, tobacco smoking, UV radiation, carcinogens in the environment, then you can sort of limit this kind of like early stage progression of the disease. But also, at each of these stages, there are actually these interventions that you can take as well. And so through the diet, there's a lot of these cancer-fighting chemicals. And if you incorporate a lot of these foods into your diet, you're actually also going to aid in the prevention. And a lot of these foods, for example, are a lot of fruits and vegetables and spices, which have very well reported anti-cancer activity, and it's specifically the little compounds which are present in these foods. I don't know if that answers your question.
It does. And staying on the theme of diet, there are also a number of articles that highlight the risks associated with supplements and herbal remedies. They highlighted in some of the research material. How prevalent is the use of such remedies among cancer patients? And what precautions should individuals take when considering these options?
Yes. I mean, look, the kind of interventions that I'm speaking about, I would say is more preventative. So it wouldn't be as a treatment for a cancer patient. It would more be sort of during that early 12-year period when you're trying to delay the onset of disease and kind of prevent the disease. So, because, there are also a lot of studies, with supplements which are given in combination with chemotherapy, and, there are a lot of reports where there are sort of beneficial combinations. But I think, where my line of research is more, and the work I've been doing is more looking at the early stages. And these sort of foodstuffs which are cancer preventative, I'm sure that you've heard a lot about turmeric, and there's a compound in there called curcumin. So that's something that we use when we make curries. Also, ginger has got a lot of cancer-preventing compounds. And actually, broccoli as well has got something called sulforaphane, which is a very well-known anti-cancer compound. And also, lastly, the one that I've been doing a lot of research on is the organosulfur compounds present in garlic, which are excellent anti-cancer agents. So I think it's more a matter of, combining a lot of these fruits and vegetables and spices in your diet to sort of aid in the prevention.
Dr. Catherine, as we wrap up our conversation, some research material also emphasizes the importance of evidence-based approaches when it comes to cancer treatment. Can we discuss ongoing research or even advancements in really understanding the role of natural therapies in cancer treatments and how patients can stay informed about credible information?
Yes. I know, that is very real because there's a lot of hocus pocus out there.
Yeah.
Look, I would say if you are on cancer treatment, you should take advice from your medical practitioner or your oncologist. Often treatment goes hand in hand with diet. So they will probably advise you on the type of diet you should have together with your chemotherapy. And I mean, a lot of it is also actually just keeping a strong immune system because you may not believe it, but your immune system is actually also an excellent at fighting cancer as well. Mm-hmm. So the diet is very important. But yeah, in terms of just being careful of a lot of stuff out there, I mean, I wouldn't jump at anyone who's going to offer you a cure. But I would definitely say, fruits and vegetables and spices have known anti-cancer. There's effects, and they should be incorporated into your diet and in cancer prevention.
Dr. Catherine, thank you so much for your time.